Hello everyone, we're talking about the development of tongue and thyroid development, and now we'll talk about the clinical correlates of thyroid development. The section has been divided into various clinical considerations which develop due to lack of completion of the process of development of thyroid. These are various conditions that may occur due to anomaly at one site or the other, at one stage or the other, and hence an abnormality in the thyroid tissue may occur. So let's see what these abnormalities are and how they are categorized and what is the cause of them. So first of all, we can have lingual thyroid. This lies within the domain of anomalies of position of the thyroid. We've talked about this earlier. The thyroid gland develops from thyroglossal duct, the thyroglossal duct developing from the endodermal outpouching of the primitive pharynx. Now this thyroglossal duct undergoes a tortuous course to come to lie in the neck and form the adult thyroid gland. However, if during its development it does not reach the neck and the thyroid tissue comes to lie within the lingual area, that is the developing tongue, this is known as a lingual thyroid. So here you can see this is the site, the foramen cecum. This is the site of the development of the thyroglossal duct. This is the path of the thyroglossal duct it takes to the adult normal position of the thyroid gland. However, if this thyroid tissue is retained within the developing tongue, this is known as the lingual thyroid. So the site of thyroid tissue formation is the tongue. It may lie below the mucosa of the tongue or at the foramen cecum or within the muscle of the tongue. It presents as with difficulty of swallowing. Other than that, it does not present with any important clinical features. However, this might be the only thyroid tissue present in the human body. So one should be very careful before excising this thyroid out. Now let's talk about sublingual thyroid. So sublingual thyroid, it lies below the tongue. It is present in high above the neck, that is just below or at the hyoid bone. So this is the hyoid bone, and this is area of the sublingual thyroid that actually lies just below the tongue and at the level or slightly below the level of the hyoid bone, this being the hyoid bone. So this sublingual thyroid also presents with somewhat developmental swallowing abnormalities. However, again, this might be the only thyroid in the human body, and the excision of which needs very careful calculation as well as very careful considerations. So intrathoracic thyroid, so this is the thoracic cavity, and the entirety of the thyroid gland is incorporated within the thyroid cavity, so the thoracic cavity. So this is known as an intrathoracic thyroid when the gland as a whole or in part lies in the thorax. Now let's talk about ectopic thyroid tissue. So the thyroid tissue might not lie in its normal position, but its abnormal position along the borders of or along the normal pathway of the thyroglossal duct. Here you can see this is the foramen cecum. This is the thyroglossal duct remnant, and then the pyramidal remnant. This is the pathway of the thyroglossal duct that it usually takes. So if at any of this position the thyroid glands comes to develop, this is known as an ectopic thyroid tissue. So small masses of thyroid are present in the larynx, the trachea, the esophagus, the pericardium, the pleura, and the ovaries. Very rarely, but it may be present there as well. Now the anomalous lobes and shapes. So what are the anomalous lobes and shapes of the thyroid gland? We can have thyroid hemiagenesis. So hemi means half, agenesis is lack of formation. So one of the lateral lobes, maybe this one, it fails to form in an individual, and this is known as thyroid hemiagenesis, that is half of the lobe is absent. Moving on, we have anomalous lobes and shapes of the thyroid gland. So let's see what are the various anomalous lobe and what are the various anomalous shapes in the thyroid gland. We can have thyroid hemiagenesis. So what is hemiagenesis? Hemi is half, agenesis is lack of formation. So half of the thyroid gland does not form or does not appear. It is one of the lateral lobes of the thyroid gland may be absent. So if one of the lateral lobes of the thyroid gland is absent, this is known as thyroid hemiagenesis. So moving on, we can have pyramidal lobe, which may either be too large or too small. Pyramidal lobe is not an anomaly in itself. Pyramidal lobe may or may not be present. However, when the pyramidal lobe is present, it may either be too large or too small. Then isthmus of the thyroid might be absent. So isthmus, which is the part connecting the two lateral lobes of the thyroid, may be absent. So moving on, we can have thyroglossal cyst and fistula. So thyroglossal cyst is being formed when there are remnant in the pathway of the thyroglossal duct. Technically, the thyroglossal duct, it obliterates in its entirety, and the point of origin of the thyroglossal duct is marked by foramen cecum in the adult humans. However, if some component of the thyroglossal duct remains patent, it forms a cyst. It is known as thyroglossal cyst. This thyroglossal cyst may communicate to the exterior and it may form a thyroglossal fistula. So it lies along the course of the thyroglossal duct. The thyroglossal duct, it usually atrophies and disappears, but a part of it may persist as a thyroglossal cyst. So here you can see this is the thyroglossal cyst, which is actually a persistent part of the thyroglossal duct. So accessory thyroid. So what is an accessory thyroid? So as the name indicates, these are the small nodules of thyroid that are found in close proximity to the thyroid gland. So this is a normal thyroid gland with its two lateral lobes and the isthmus. This is the accessory thyroid, which is a thyroid tissue which is present very close to the normal thyroid gland. So this was all about the clinical abnormalities in the development of thyroid. When there's any defect in the clinical abnormalities, or when there is any defect or a clinical abnormality, it is important to investigate whether the normal thyroid gland is present or not, and whether the surgical correction of that anomaly would help the individual or put it on a lifelong thyroid treatment. I hope you found this lecture interesting. For further such lectures, keep watching sqadia.com.